I'm Vicki Liviakis, and welcome to Body Beautiful. This is the show where we talk with local professionals about the latest in cosmetic procedures and medical devices. We also take your calls live on the air, and with us today we have plastic surgeon Dr. Rex Moulton-Barrett, and we're going to be talking about abdominoplasty primarily. We'll take your questions regarding anything plastic surgery. The number to call here is 800-440-4884. We'll also be posting the phone number to the doctor's office, so be ready to jot that down. And before we get started, any advice we give you today, obviously you're going to want to consult your own physician. Welcome to the program.
Thank you.
We were talking about abdominoplasty. It's a big word. Exactly what is it?
Well, it's the same word as tummy tuck, and it's a procedure where you can remove the skin and the subcutaneous tissue from above the umbilicus, the belly button, down to the pubic area, and then redrape the skin above it down to that area and make a small incision to receive the belly button, which is still attached to the tummy wall. And the effect is to dramatically reshape the abdomen, and it's an opportunity when you're doing that procedure to tighten up the muscles as well.
One of the things that, I mean, this is something that usually it's the end of the line after you've tried a number of things. Is this serious surgery, obviously. So if someone has gone to the gym, they can't get rid of that loose skin, and the muscle has gone slack. Primarily, who does this affect?
Well, I think for the greater part in my practice, it's women that have had children. And the baby is a large tissue expander. And afterwards, the muscles have been splayed apart. Now, the muscles we're talking about, they're called the rectus abdominis, which means rectus means straight. But in reality, they become splayed apart. And so even with a good workout in some people, that abdomen will never be flat again.
So are people genetically predisposed to either be able to spring back rapidly, their muscles, you know, take the former shape, or at least the closest thing to it, and then others just can't do it no matter what?
I think there's a component of that, but I think it's also fair to say that many people gain more than 20 pounds during pregnancy, and so the volume of that abdominal contents really causes so much distension that even when the baby's out, nothing can come back together. So typically when you've gained sort of 40, 60 pounds, you know, with pregnancy, it would be very difficult. There's stretch marks, loose skin, and loose tummy muscles. And
I would imagine, say for someone who's had twins or triplets, I mean, that just kind of, you know, increases the the chances of let's see, expanding. Is this something that there's some people that you recommend do not approach this, or is this in terms of the scale of surgeries, say for instance liposuction compared to the actual abdominoplasty? How does that weigh out?
Well, liposuction has its role in certain people, and really what we're talking about is someone that's got good tone to the skin. And so if a lady came, she's had some twins, and the skin's got stretch marks, and the skin's loose, and you were to do liposuction to that area, you'd essentially worsen the problem. And then there's people that it's not advisable. For example, someone that thinks they're going to be pregnant again, it'd be inappropriate to tighten the muscles, put in permanent stitches, and really make that tummy flat, knowing that it's going to be distended again by a baby.
You know, it's a cruel thing when you at the grocery store and you see these magazine covers of these actresses, and they've just had a baby. It seems like the month before, and all of a sudden they show up looking svelte, like nothing ever happened. Are they? Is there a secret that they have that they're not telling anybody else, aside from airbrushing?
Yeah, Photoshop.
Yeah.
Right.
I mean, how common is an abdominoplasty after you know, having a baby, for instance?
Well, I think in certain people, when they know they're not going to have further children and the damage is done and they didn't spring back like you talked about, it's a very common procedure. It's actually the fourth most common plastic surgical procedure in the U.S., about 195,000 procedures per year in the U.S. It's fourth after eyelid surgery and breast augmentation and liposuction. Really?
Mm-hmm. And in terms of the age of the patients that you usually see, what's the age range?
Well, in my practice, from as young as 23 to as old as 68.
Really? Okay, well, we have lots of calls coming in, so obviously there's some interest here. We're going to need to take a very quick break, but Dr. Moulton-Barrett has a special offer for our viewers. If a consultation is made before December 31st, 2009, you will get 15% off the normal professional fee for a surgical procedure. And for more information about Dr. Moulton-Barrett, you can call 510-864-1800, or you can check him out on the web at moultonbarrett.com. And when we come back, we'll take your phone calls and continue our chat about abdominoplasty.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor. The opinions expressed on the program are those of the guests and not those of KRON TV, its management, employees, or advisors.
Welcome back to Body Beautiful. Right now we are talking with Dr. Rex Moulton-Barrett about abdominoplasty. We'll be taking your calls with any questions you have. The phone number 800-440-4884. And we'll be posting the number for the doctor's office during and at the end of the segment. And remember, any advice we give you today, you always want to get a second opinion. That's good advice, isn't it?
Yeah.
Doctor, before we get to some pictures, I just wonder, abdominoplasty, we talked about it just before the break. I mean, really, how common a procedure is it?
Well, as we mentioned, it's the fourth most common plastic surgical procedure in the U.S., and just under 200,000 people a year in the U.S. undergo this procedure.
Okay, let's go ahead and go right to the pictures so that folks get an idea of what we're talking about here. This is a woman who has had children.
Yes, if you see the picture on the left, you'll see there's a little fold. That's from a cesarean section, and that's a pretty common phenomenon that the skin falls down onto that scar, and they don't like it. And often beneath it is an area where there can be a fullness of skin also.
Now, you mentioned a cesarean section. Is that one of the culprits? Because, you know, once you cut those muscles, it's really hard for them to, well, I guess, take their shape back again, right?
Well, the gynecologists say not, because they're really shaving the outer fascia off the muscle and then they're going in the midline, so it shouldn't really cause that. I think what happens is the scar tissue from the skin attaches directly onto the muscle, and then the skin falls onto that scar. So I think that's the major culprit.
Okay, and let's go ahead and look at another picture here.
And here's a lady, and you might want to know what happened to that tattoo on the left.
I was going to say, what is that? That's a tattoo, okay.
Right, and so where do you think it went?
It got cut away?
Yes, it was removed. So the skin above that tattoo is brought down to an area about 3 or 4 centimeters above the labia, so we can have a nice bikini incision. And this is one of the modern advantages of using a technique in which you sit the patient up in the operating room. So you can bring skin from well above the belly button to a very low position where the scar should not be visible when they're wearing underwear.
So I imagine this is something that the patient actually asked you for?
Yes.
They were done with that.
That's right.
So, okay, we have one more here. Now, explain what's going on here.
Yeah, so people don't really talk about it, but an abdominoplasty is a way to get rid of excess scars from previous surgeries. So here's a lady that's had a very disfiguring scar from previous infection following an abdominal surgery. And so I can bring the skin from above the umbilicus all the way down to the pubic area and remove that scar completely and then recontour the abdomen. And if you look at the muscles, if you look in the midline and then to the side, you'll see these vertical columns. They're very widened to the sides. We can bring those back together, and it can give the illusion that she's got a six-pack afterwards.
I was going to say, this looks like they've been to the gym, but no, this is all surgical.
And it's a tightening of the muscles.
And I would imagine one of the concerns is scarring, but you managed to hide it in the bikini line, or where are the scars?
The scar is...
We're not seeing them, obviously, in the pictures. That's good news.
Yes. Yeah, the scars are hidden right low, right where the underwear would be, and we're using a newer type of suture that dissolves at about 3 months. It has little barbs on it, and it's subcutaneous, which means we don't have to put any stitches through the skin itself. We actually glue the skin, and then we have the patients manage those scars for about 6 months. And what we're finding is that the scars that normally tend to spread over time, widen out, they stay like a little hairline. And then with taping their scars for 6 months and really nursing them with the assumption that scarring isn't a temporary process, it really takes 6 months, we can get very nice results. Is
abdominoplasty difficult or painful for the patient?
I don't think it's a difficult procedure, but I think you have to approach it artistically. You have to think that the abdomen should have a certain shape, and sometimes just simply removing skin and fat is not enough. Some liposuction on the sides for contouring, the sculpting of the tightening of the muscles so that it has the right shape. And then in terms of pain, it would be a painful process if you didn't obey certain things. Certainly patients we find now the use of muscle relaxants reduces tremendous amount of pain because muscle spasm is the main reason for the pain. We have little pain pumps which are tubes a little thicker than a hair, which drip small amounts of local anesthetic, the same sort of anesthetic you use in the dental office.
And that would be the initial recovery stage?
Yeah, for about 5 days. And so, and they take those pain pumps home with them. Many of our patients, they rent a surgical bed so they can be in the sitting position at home, so there's no tension on the wound. And then we use a fairly tight binder around the abdomen. Again, it helps reduce the muscle spasm.
Any other problems associated with abdominoplasty which are technique dependent?
Well, if you didn't sit a person up and you, for example, look at that lady that had that tattoo, in some cases like that, you'd have to make a vertical scar in order to close where the umbilicus used to be, and that's unacceptable these days. We can sit them up and we don't have to leave any scars somewhere between where the new belly button is and the pubic area. Okay, we're going to be taking some calls, and we have more pictures actually to show you, which are so informative. For more information about Dr. Rex Moulton-Barrett, you can call him at 510-864-1800 or check him out on the web at moultonbarrett.com. And when we come back on Body Beautiful, we'll continue talking about abdominoplasty, and we'll be taking your phone calls. For more information about our show, go to KRON4.com and click Body Beautiful. Once there, you can see videos of past shows and get contact information for the doctors we featured, as well as listings for future shows. Welcome back to Body Beautiful. We are talking about abdominoplasty with Dr. Rex Moulton-Barrett. And first, let me remind you that we'll be taking your calls live with your questions. Here's the phone number, 800-440-4884. We'll also be posting the numbers for the doctor's office during and at the end of the segment. And remember, any advice we give you today, you certainly want to consult your own physician as well. Doctor, before we start jumping into these phone calls, any other benefits besides the obvious ones of changing your shape? Yes, there are. We found that in patients that follow a protocol regarding diet and exercise, that they can lose somewhere around 15 to 20 pounds, and that weight loss is sustained at 1 year in about 65% of all our patients. Okay, and we all know that weight around the heart area, which would, I guess, include the abdomen, yes, taxes the heart. Yes, so I think any weight, simply being above what would be considered normal weight. And we know that 65% of the population are overweight, about 25% are obese, and about 3 or 4% are actually morbidly obese in the population. So we can reduce 15 to 20 pounds in certain people. That can make the difference between being healthy and unhealthy. Okay. I promised we'd start taking some phone calls, so let's go to Sharon in Oakland first. Sharon, do you have a question for the doctor?
Yes, I do, and good morning to the both of you.
Good morning. Good morning.
I was wondering, once you receive the surgery, do you have to do exercise, to keep the shape?
I see. The question is, do you need to exercise after surgery? Yes, indeed. And some people feel that you should wait several months. We actually like people to start working out at about 6 weeks. And we have a regimen, we call it the 3 S's. It's a South Beach diet. It's sugarless home with no sugar in the house at all. And then a stationary bicycle pointed at the television, because we know people do watch a fair bit of television. Right. And when they're on the stationary bicycle, we like them with a heart rate of 135 for about 45 minutes, 3 times a week. In fact, we've gone one step further. We have a TV contract, so that the loved one or whoever's in the house, they're not allowed to watch television unless this person's on that stationary bicycle, monitoring the heart rate and making sure they're on it and actually doing it. So that is just, forcing healthy habits, or just to keep the shape? Well, I think the issue really is how do you maintain the weight loss? And so the concept of less food in and the more calories burn off, that's what we're trying to foster and continue that over that year. No sugar? Does that include chocolate? Absolutely. Oh, darn. All right, let's move on to Kathleen from San Jose. Good morning, Kathleen. Do you have a question for the doctor?
Yes, I do. Good morning to you, too.
Good morning. Good morning.
And I had surgery over 40 years ago, and I have a vertical scar that goes around my belly button, and I was wondering if there's a procedure that would take care of this?
Okay, so the question is if that scar went around the belly button, and is it vertical below, going downwards, or above?
It goes right on the side of it. It's about 9 inches long. Looks like a railroad track.
Right. I think with that technique where we sit you up in the operating room, that should all be removed. And we bring the skin from above the belly button, so long as the scar doesn't go much above that area, and we can bring that down to the pubic area, and so it would be removed completely. Wow.
All right, Kathleen, we have a couple more photos, so let's go ahead and take a look at those before and afters after an abdominoplasty. Here's another example.
So the image on the left is a lady who's had bariatric surgery. That's the surgery where you remove a portion of the stomach and you bypass the bowel, and so she's already lost about 130 pounds. And unfortunately, she then developed a tumor and had further surgery of the abdomen and then got a wound infection. So she has what I call a geographic abdomen with lots of scars, and she wants to get rid of that scarring and the folding and the irregularity, and so this is a good procedure to do that. So it's the same technique of bringing the skin from above the belly button, bringing it to a very low point, and then removing all the excess scar tissue and then tightening up the muscles.
You know, it almost doesn't look like the same person.
She's lost some weight as well.
But what you've done with the scar tissue, you've been able to remove that, you've tightened the skin. Wow, okay, and here's another example.
So here's a different sort of problem. Here's a lady that really has failed all our dietary measures, and she's still overweight. She's about 220 pounds. And she has that ballooning outwards of the rectus muscles in the midline. And so what we want to do is remove that lower pannus, that sort of horizontal fold, and we want to narrow the muscles. So for her, we're using that technique where we're going to sit her up about 45 degrees at the back and 45 at the knee, and we can bring skin from well above the umbilicus to a low point, and we can tighten the muscles up, and you'll see that the muscles now are flat, and it's almost half the diameter of the width of those rectus muscles after surgery.
Again, it almost doesn't look like the same person. We need to take a break here, but for more information about Dr. Rex Moulton-Barrett, you can call him at 510-864-1800. That's the correct number. Or you can check him out on the web at moultonbarrett.com. And when we come back on Body Beautiful, we'll continue our chat about abdominoplasty, and we'll be taking more of your phone calls. Welcome back to Body Beautiful. We'll be taking your calls with any questions you might have about abdominoplasty. Here's the phone number, 800-440-4884. And again, we'll be putting up the number for the doctor's office during and at the end of the segment, so be ready with your pen and paper to write that down. And remember, any advice we give you today, obviously you want to consult your own physician as well. Let's go ahead and jump into try to get through some of these calls. Amy from Santa Rosa. Good morning, Amy.
Good morning. How are you today?
Great. How are you?
I'm doing well. My question is, I've had 4 children, and I recently had my last child about 3 months ago. How long do I need to wait in order to have the surgery?
Okay. I think the question is how long to wait after having a 4th child. It would be ideal that you're fairly sure you're not going to have any further, and that may mean a tubal ligation. If that hasn't been done, it's not a bad idea, or the appropriate with the husband. And then normally we like to wait about 6 months. And why do you wait 6 months? Just want to make sure that the healing is complete, and that the abdomen itself is stable, so that when you're contouring it, you know that it's in its permanent position.
Okay, and I'm hearing from my producer, I don't know, Amy, if you're still there, but she had a follow-up question about gestational diabetes.
Gestational diabetes,
yeah.
And I am, trying to follow that healthy diet so that I don't get diabetes in the future. But what kind of health do you need to be in order to have this surgery? What if I had diabetes? Is that a factor?
I've performed abdominoplasties on people that have diabetes. People have thought that there's issues regarding wound healing, that the white cells don't work as well, and there's possibilities of infections. But if it's controlled well, it's not in any way a reason to stop you from having surgery. But usually with gestational diabetes, it tends to improve over time after pregnancy. Is that the case with you? Are your sugars normal now?
I'm real happy to report that.
Yeah.
Okay.
All right.
But I don't think it should be a problem to have surgery just because you had gestational diabetes.
Okay. Well,
thank you very much.
all right. Thank you, Amy. Question, doctor, is the weight reduction permanent or temporary?
All right. Well, we looked into this, and so I studied my patients over 2 years, and what I found was that at 1 year, 65% of the patients maintained the weight loss. And we studied as to why do we think that was, and it turned out they had a sense of fullness, and that when they'd either eat half as much of what they did and felt full, or they generally didn't feel as hungry most of the time. We call that satiety.
Is that psychological or is that a physiological function? I mean, you haven't done anything to the stomach.
Well, we've actually created an internal corset. And so if you look at it from a physiological point of view, we've squeezed the stomach from the outside in. And if you study what are the reasons why satiety occurs, there are at least 12 gut hormones that are released when the stomach is compressed. And each of those may have an effect on the sense of fullness.
Well, okay.
And we're studying that, and in fact we have a grant that's pending to see if we can look and see which hormones that are most affected when we do an abdominoplasty.
So conversely, I just wonder if once your muscles do become slack, then you lose that feedback system.
Right.
Okay.
I think that's the reason, you know, after Thanksgiving why we want to eat more.
Yeah. Let's try to get in one more call. Tracy from Alameda, do you have a quick question for the doctor?
Yes, hi. Thank
Hi.
you for taking my call. I wanted to know if you could get the abdominoplasty and a breast reduction at the same time.
I see. Can you do both surgeries at the same time? I think the answer is yes, you can. What most people like to do is limit their surgical time to about 6 hours. And typically a tummy tuck takes somewhere between 2 to 3 hours, and a breast reduction about 2 hours. And so they can be done at the same time. I would advise definitely an overnight stay, and stay either at a surgical facility or at a hospital for those first few hours after surgery, because there may be some issues regarding pain control as well as the ability to take in a deep breath. If we corset those muscles of the abdomen, it hurts to take in a deep breath. And after a breast reduction, sometimes the muscles of the chest wall can be inflamed, and so we need to really watch you carefully during those first few hours after surgery.
All right, Tracy, thank you. That sounds like a mommy makeover, total. Again, I want to mention that if you make your consultation before December 31st, 2009, Dr. Moulton-Barrett will take 15% off the normal professional fee for a surgical procedure. So that's good news for our viewers. Thank you very much for visiting us, Doctor.
Thank you very much.
Unfortunately, we are out of time. But we'll be back with another program next week. Thanks very much, everyone. And for more information about Dr. Rex Moulton-Barrett, you can call 510-864-1800. That's the correct number. Or you can check him out on the web at moultonbarrett.com. Join us again next Monday at 11 for another edition of Body Beautiful. Thanks for joining us, everybody. Have a great day. For more information about our show, go to KRON4.com and click Body Beautiful. Once there, you can see videos of past shows and get contact information for the doctors we featured, as well as listings for future shows.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor. The opinions expressed on the program are those of the guests and not those of KRON TV, its management, employees, or advisors.